Good morning, everybody. My name is Paula Igualada Martinez, and I'm the chair of the Physiotherapy Committee. And today with me I have Marie-Pierre Cyr, professor at the University of Montreal, and Georgia Walker, a physiotherapist at the Cleveland Clinic in Abu Dhabi. So welcome, guys. Good morning.
Thank you. Good morning.
And we're going to sort of discuss what's been happening in the physiotherapy world at this conference. Does anyone have any preference, Marie-Pierre?
You want me to start?
Yes.
So one of the highlights,
Yes.
I would say it's the Physiotherapy Forum.
Yes.
We had many different speakers coming from different parts of the world, also at different level in academia.
Yeah.
And I think one of the highlights of that conference, it was really to get to know that there are new techniques being developed, new instruments being used.
Yes.
And there is a need to be mindful of when we have new things coming out of research to think afterwards for clinical implementation.
Yes.
So yeah, I was mind blown by the quality of the presentations and how there is a lot of thoughts about thinking about the implications of using these types of techniques or instruments in clinical practice.
Yeah.
It's good to be mindful of that because we always need to balance, well, is it going to be helpful for us for practice and also help patients eventually, and then we have to balance with the available resources.
Yes.
Because it's all in a really big system. I was really happy with the content. Yeah.
And for you, Georgia, this initial experience in ICS, how was it for you?
Yeah, it's been brilliant. So this is my first ICS, and what a privilege for it to be in where I live. So I've been here for 7 years. I've worked in Abu Dhabi that long, and how lucky I feel, quite patriotic, if that makes sense, for it to be here and for me to be able to be here and be invited to speak at the Physio Forum as well, and be able to mingle with, of course, you. I've met Angie from my lecturers from Brunel, but also people that I admire in research. Some really long-standing big names speaking about their experience has been incredible, and some new people in the talks and to the stage as well. It's been a great experience.
And thanks to the presentation you did, you also have made some connection here, in this part of the world, which is actually crucial for patient care, right?
Yeah, exactly. And we spoke about that yesterday, didn't we, after the talk, and speaking about my experience in Western physiotherapy and maybe the limitations here working within the UAE region, and how can we overcome that as a physiotherapy profession. And I think working together and sharing our own experiences and knowledge is really important for that. There were physios here from Oman, just next door, from Bahrain, and from the Gulf region. It's been great.
Right.
And may I add, I've been coming here for a few years already. I'm part of the ICS Physiotherapy Committee, and we are working together.
Yes, it's true.
I feel coming here, it acts as a reminder that there is a continuum of care.
Yes.
And everyone has a role to play.
Yes, that's absolutely right.
Within a patient trajectory,
yes,
it might go in so many directions. And it's good to remember that we are working towards the same goal of improving quality of life.
Yeah.
So I am really advocating for interdisciplinary approaches. Yeah. So I'm very happy to be able to contribute to this mindset.
And actually one of the beauty of ICS is that interdisciplinary and multidisciplinary way of working. You don't have many international conferences, associations where all, as you say, that continuum, everyone is involved. I think that's the beauty of this conference, that yes, we have our own specific physio forum or physio activities, but then you can go to the other scientific sessions and learn for what other disciplines are actually doing, and then it will help you with your clinical reasoning, your treatment goals, helping with the prognosis, helping the patient to understand what is at the end of the road, should what you do don't help them, so I think that's a good Thank you. That's a good one, Marie-Pierre.
And regarding Georgia's presentation at the Physiotherapy Forum yesterday, she really highlighted social-cultural differences and how it can impact how we can deliver care. And it may also influence training as well of practitioners. So I don't know if you want to talk more about that particular part of your presentation.
I would say I think here is a very highly expatriated population. So we have viewpoints from everywhere, all over the world, which is great. But I think definitely from a physiotherapy standpoint and training, locals aren't as, how can I say, it's not till the latter years that physiotherapy has been, at university level here. So, locals are now being trained up, but it's a very recent thing within the UAE. So, I think there's such big things to come, and I'm so excited for it. But I think what we can do is share our knowledge from our international backgrounds and really help the locals, train up within this field and otherwise. So.
And a big thing, obviously, what we talked yesterday as well, and it goes back to your experience as well, is that the standardization of pelvic health physiotherapy and how we all in here come from different backgrounds that have different experiences in the way we train, right? And part of your project, you did a fantastic questionnaire yesterday.
Yeah, that was great. So good to see.
Been lifetime.
But I had help from the ICS Physiotherapy Committee members, of course.
But we're looking forward,
Yes, because...
Can you just tell, a bit of we were trying to achieve with that questionnaire?
Yes. So in 2023, I did come up with the ICS Physiotherapy Committee about this idea that, there are online modules, there are courses, individuals in physiotherapy are being trained differently around the world. Well, what should we do about it? So perhaps let's have a look at what is being done and perhaps try to see the best way to train future pelvic health physiotherapists. So we did conclude, let's have a look at the documentation, what are the training programs, how people are educating themselves to be able to practice in this field. And we also developed a survey, and that survey, it was available for 4 months last year in 2024. And results are still being analyzed, and we are going to write the publications, but 249 physiotherapists around the world participated and completed that survey, and it really highlighted global variations in training modalities. So there might be gaps to address, and we know that there are even less sometimes presence of physiotherapy in specific countries. And I've been approached by different people here being like, well, what can we do? Is there a way that we can just initiate training, increasing awareness among physiotherapists that this field is something we can actually do and provide as a service for patients. It's really interesting, and we are hoping to develop eventually some recommendations as to how we might train physiotherapists in considering available resources, social cultural factors, and also the costs, and trying to figure out, well, what should we prioritize, and then going down the line based on what is actually possible. So I'm really hoping with this effort, there will be this collaborative international effort of let's bring together, let's ask money to governments to really support this humanitarian kind of movement to just improve the health of everyone. Basically, that's what we want to achieve, right? So I'm really hoping that's what we're going to achieve in the end.
And I think that's really going to help, in the situation we were talking about within this country, that guidance is, of course, just going to help us standardise the education and the care that we provide in pelvic health physio.
No, I think it's a big project, the ones that we have actually been submerged into, but something that is actually required just because of, we need to remember that all the national and international guidelines recommend conservative physiotherapy management first, and yet, there is that sort of lack of physiotherapists or specialist physiotherapists that can actually do that conservative management, right? So yes, let's hope that we get there. Have you been to any other sessions, any other urology sessions, any other sessions that you're going to take home apart from our physiotherapy forum?
Yeah, so actually just this morning, and I've just messaged my friend who works in pelvic health physio here, and I just said I went to such an incredible and informative session it was a roundtable talk with occult neurological symptoms in the Euro patient, and so interesting. This is something I want to help learn and educate myself more on, because these are what I would call these complex cases, definitely, that come into my clinic room, and the things that make you think, okay, should we be thinking something else, and how do we manage it, and who should be involved? And it was such an informative session for everyone, I think, that works with the urology patient, and everyone actually said how informative it was, and hopefully that this talk should become available for others, outside of the ICS, to learn from and change our practice. Really, it was great.
Good. What are you, Marie-Pierre?
I might have two highlights. I participated, even though I have a research background, there was a workshop on the very first day, just before the conference. It was about ethics for the non-experts and early career professionals. And I really liked how they presented those case studies of, well, in that clinical context, should we do a research? How should we actually do it? And then even discussing about the role of industry when you are analyzing the data, do you make it available or not? Like, I felt these questions, a lot of clinicians have them. And of course, this influence within the system that those clinicians are in, and the pressures that they have on their shoulders of using specific products or those kinds of things. I felt it was really interesting. And then my second highlight, I think it's the increasing use of technologies and telehealth practices, because the goal is to try to provide care to as many people and as many individuals as possible. And I kind of appreciate when we're trying to understand the pros and cons of using that kind of those kinds of technologies. So I feel there is a lot of potential, and there is still a lot of work to be done, and I'm excited as well for what is coming.
Good, very good. Any other highlights? Anything else that you would like to?
Honestly, just away from the talks, just being able to meet so many different people working within this, as you say, with the same goal, within the same field, and again, people that you read about and, highly renowned in research. And it's great to just be able to feel part of a community with a shared goal. That's been a great highlight, to be honest.
Fantastic. Yep. Okay.
And what about you, Paula? Can I ask?
I was thinking the same.
Can we ask you a question?
Yes, that's a very good point. But you know what? Not that I am biased towards a physio,
Aren't we all physios right now? We're all maybe biased.
I honestly think that the physiotherapy workshop, I really loved the summary of the exercises, the dosage, the evidence behind of what we do with each pathology. I think for me was actually a highlight in that sense. I also really been doing 2 of the bowel workshops. So, I think again, very much bowel is a small specialty within ICS. So, I have enjoyed those as well. So, but yes, I think my highlight most of the times is not just only participating, but I think again is meeting all these people, as you say, Georgia, catching every year with friends, colleagues, I think being here, learning from everyone, for example, on the Physiotherapy Forum, Ida from Spain, she's doing a very specific topic, but again, it goes back to telehealth, reaching out there. How can we improve the care of women, in particular, with pain, sexual pain? No one talks about pain either, right? So, that sort of telehealth, I'm really interested as well. So,
well, I'm glad you've had a good time as well.
I have had a good time always.
Well, we're all together in this experience.
Yes.
That's great.
No, it's been brilliant actually. So, thank you.
Thank you.
Great. Yeah.